Hi, it's Gary Foster. I'd like to welcome you to this series of interviews where I get the opportunity to meet with some of the country's top therapists. Today I have the pleasure of interviewing Greg Wimbourne. Greg heads up the Kaizen group of clinics and they specialise in what's called pathogenics. And that is a field of complementary medicine where literally they will almost guarantee the cure from chronic illnesses. I know it sounds a little bit outrageous and there might be some people aren't quite sure whether this particular approach could help you or not. Just listening to what Greg has to say and then make your mind up at the end. Mr. Greg Wimbourne.
Well, Gary, the simplest way to describe what we do is that we treat chronic conditions, things like IBS, migraines and skin conditions such as eczema and psoriasis. We treat people who have ME or chronic fatigue and also urinary infections or issues.
I think that when we last spoke you said that as a group you specialise in what's known as pathogenics.
Yes, pathogenics is essentially the investigation and isolation of the pathogens that are actually causing those chronic conditions.
And a pathogen is?
A pathogen very simply is something like a bacteria, a virus, fungal infection, a parasite, worm, anything I suppose that is in your body that shouldn't be there.
Okay, so the interesting thing maybe for people watching this video today is, so how do you actually locate those pathogens?
Well, the interesting thing about everything that's alive is that as well as having a unique genetic signature and a unique chemical signature, it also has a unique electromagnetic signature or a frequency. And it is this unique frequency that we look for. So we have a large library of different pathogens with which we test against the patient, and when we get a match we get a certain type of reading. And if we get the match, we know that that is part of the problem, one of the pathogens that are causing whatever issue you might have. If we get a reading that shows that it isn't there, we therefore know, of course, that it isn't part of the problem. It's a very simple test. It's like the computer on that television program which says either yes or no.
That's good. Now, I know that it could take a long time to go into all the infinite details of how you do this, but in layman's terms, how do you find that frequency?
Do you mean actually with, do we find the pathogen?
Right.
Yeah.
Well, on a first visit, if someone wants to consult with you because they've got one of those chronic illnesses that you mentioned, how would you locate that frequency?
Okay, well let's go back to the situation where let's say you have a chronic condition and you've tried mainstream medicine, they've managed to manage it or suppress it, but as soon as you stop taking whatever medication you've been given, it just comes back. You've probably tried Chinese medicine, acupuncture, hypnotherapy. There are loads of methods of treating and managing conditions, and actually I think the majority of them are management systems. Most of them will have some effect. Some of them actually resolve the situation, which is fantastic, but in the majority of cases the condition tends to return as soon as you stop the management that you are doing. So we're a kind of port of last resort. People have tried lots of different methods to deal with their problem and have failed and have gone on to the internet and hunted around and probably stumbled across us. And what we then do is, having talked to them, they think, okay, well, we'll give it a go. Got nothing to lose, especially because of course we give a guarantee that if after 2 months you're not seeing any results, you can ask for your money back. They come for the first consultation, which generally takes about 2 hours. Now we often take less than that in the consultation, but we want to be sure that we've got enough time to go through the history and hunt for the pathogens and make sure we cover all the bases and find all the pathogens that are actually causing the problem. So in the first part of the consultation we go through the patient's history, when it first started, what the symptoms are, you know, what kind of variation occurs at different times, because some pathogens have a kind of life cycle which will cause different symptoms. And then after that, we do the testing of the body to check whereabouts the focus of the condition is. For example, if someone has a digestive issue, it could be focused in the stomach, or the small intestine, or the large intestine, or even the gallbladder and the liver. They'll all have a knock-on effect on each other, but one area will be the core of where the condition is worst. And that helps us look for the pathogens, because some pathogens like to hide out in the small intestine, some tend to be in the large intestine, and so on. And then the third part of the initial consultation is to test for the different pathogens and confirm which ones are actually causing the problem. And then the next stage after that is to actually start the treatment. I should point out that on the treatment you come back on a regular basis for updates, and they take about 30 to 40 minutes rather than the 2 hours.
How long would a programme of treatment take then?
Difficult question to answer. Unfortunately, when someone comes to see us, they've usually had their condition for a long time. Now, the nature of this kind of condition is that it's almost certainly multiple infections, not just one pathogen that's causing the problem. The reason behind the fact that there are multiple infections is that you will have caught an initial infection. Let's deal with the digestion for this instance. So say you've eaten some food, had some listeria on, got food poisoning, you suffered badly for 2 or 3 days, and it seemed to go away. But some of the listeria actually survived in the gut and over time has built up. Now the immune system will try and get rid of it, but in many cases it's not quite able to do it. So what if you like, the commander-in-chief of the immune army says is, okay, well, we can't let you just have wild time and run amok, so we're going to put some of our soldiers and surround you and keep you under control. Well, this therefore means that your army, which is finite, now has, let's say, 15% less of its soldiers on guard duty at the borders where infections come in, because of course the immune system every day is killing incoming, and that's its job. But bit by bit, if you find that a pathogen manages to get through the defences and establishes itself, you've got to keep it under control, otherwise it will cause problems all the time. And you can see what's going to happen in time. Enough of them get through that the immune system is now compromised, and the gut in this instance starts to have problems, and that's why you get this chronic condition. So what we have got to do is find out what those pathogens are and eliminate them, because once you've eliminated them, logically, they can't cause any symptoms because they've gone.
So what you're saying is, depending how long someone's had their condition, might indicate how long it might take for them to get
Yeah, I mean,
better again.
this is not a quick fix. I have to be absolutely brutally honest about it. This is not a quick fix. But the majority of people would have had their condition for 3, 5, 10, 20 years. And, if you say to someone that it's going to take 6 months or 15 months, whatever, in relation to the length of time they've had something, you've got to take it in that perspective. Generally speaking, actually, it's a strange thing that there's certain chronic conditions do take a lot longer than others. For example, migraines and cluster headaches seem to be the easiest one to get rid of, and in 3 to 6 months they'll be sorted, whereas a skin condition tends to take a very long time. But if you think about it, once your skin is compromised and it's cracked and it's open, stuff can get in straight into the bloodstream and into the subcutaneous tissue very, very easily. So it makes sense that there are going to be lots more infections going on there. So it does depend what your condition is on how long it takes to eliminate it. But I think, do not expect that, you come for one visit and you're better. It doesn't work that way, unfortunately. Wish it did.
So tell me, Greg, how can someone book on to one of those initial consultations?
Well, that's easy, Gary. All they have to do is ring the clinic on 01234 325 155, or they can email at info@kaizenclinic.co.uk, or if they're not watching this on the website itself, they can visit kaizenclinic.co.uk.
Excellent, outstanding. Greg, thank you very much for inviting me today. Really appreciate it.
My pleasure.